Yes, sure.
Okay, forget about your own policy procedure right now. This is an abstract question, away from this case. Do you agree that departures from policies and procedures by the psychiatrist deserves a documented explanation?
Foundation.
What I agree with is that there's a usual and customary practical working out of how we apply the rules, and that our usual and customary practice was only to have highly suicidal patients on suicide on eye to eye.
Objective's not
So
responsive.
I don't think any policy was violated.
Objective's not responsive. Was there a conscious decision not to have Matt on eye-to-eye observation by you?
No.
It was, how'd you make the decision not to have him on eye-to-eye?
I made the decision on the basis of the clinical material that I had, that I thought Q4 hours was appropriate in view of his progress, his excellent therapeutic alliance. I believe he had a good therapeutic alliance with me and with Doug Dodge, who was his primary counselor.
Objective's not responsive.
And let me jump back. I want to object to your 2 questions ago on form, because for obvious reasons.
Okay, listen to this question, please. Was there a
Object to the prefatory part.
Was there a conscious decision not to have Matt on eye-to-eye observation by you?
You know, I think when you make a clinical judgment, that's a conscious decision. My conscious decision was to have him on Q4 hour checks.
So there was a conscious decision not to have him on eye-to-eye by you, true?
Form.
There was a decision to use my clinical judgment, and my clinical judgment said Q4 hours was appropriate.
So you consciously decided that?
I believe so.
Okay, the Meadows had 3 different levels of care in 2004, did it not? Acute level, intensive inpatient service level, and partial hospitalization.
Yes.
Matt could not be transferred from the acute psychiatric care until he was determined by a physician to be physically, mentally, and emotionally stable. Do you agree with that?
Yes.
Matt was not stable enough to be transferred from the acute psychiatric care unit during the entire time he was there. True?
For 2 reasons. If someone's in withdrawal, we keep them in acute care, and if someone has some suicidal ideation, we keep them in acute care.
So your answer to that question is yes?
Yes.
The Meadows had a duty to provide a safe environment in the acute psychiatric care unit. You agree with that?
Foundation.
Okay, Matt was in crisis on Saturday and Sunday, or he would have been stepped down to the intensive inpatient level of care. True?
Foundation.
Not necessarily. He was also in detox, and we keep people, anybody who's in detox in acute care.
Well, he was in crisis because he was in detox, right?
Foundation.
As I said, a fluctuating clinical picture. He was doing much better at times and worse at times. I believe he was doing much worse late Saturday night.
Well, if he had not been in crisis on Saturday and Sunday, he would have been stepped down to the intensive inpatient level of care.
No, he wouldn't, because he'd still be on detox from Xanax.
I'm not sure he was done with your question. Were you done?
I was done.
Okay, excuse me.
He would still be on detox from Xanax, so he was likely to be in acute care for 2 or 3 weeks.
Have you read the policies and procedures on what the definition of being in crisis is?
You want to
I'm just
review those? I
asking
haven't
you.
read them just recently. I've read them in the past.
What portion of the Meadows was supposed to be secure on the Sunday morning Matt died?
Objective form.
I don't know what you're asking.
Was there any portion of the Meadows that was supposed to be secure on Sunday morning?
Form.
that Matt died.
I don't know what you're getting at. Is there a certain physical area that's supposed to be secure?
Yes?
I suppose the acute care area.
Now, the acute care unit at the time of Matt's death should have been able to be secured with locked doors. True?
Well, in practicality, we don't do that. We have that capability, but we've done it twice in about 8 years.
How was Matt able to leave the metals on Sunday morning and hang himself to death?
Form.
He got up at some point, I guess in the morning, Sunday morning.
He just got up.
His roommate apparently thought it was around 5 a.m.
So Matt was
Just
able,